Hello everyone, this is Banjot Kaur. I'm health reporter with The Wire. I have with me Professor James Smith today, who is an MBBS MA and an MSc. He is a lecturer in humanitarian policy at UCL Institute of Epidemiology and Healthcare at London. Professor James, along with his colleagues, recently wrote an editorial in BMJ Global Health, a BMJ group of journals, on the ongoing conflict between Israel and Palestine. If I'm not mistaken, this is perhaps the first editorial to be written in any medical journal on the ongoing conflict. Professor James would please correct me if I am mistaken here. Before we talk about the generic aspects of this conflict, I would, Professor James, request you to, answer a few questions related firstly to your paper. In the paper, you take a very strong stand and you say that the most recent healthcare related attacks follow a long history of Israeli violence against healthcare workers, the destruction of health infrastructure, the systematic obstruction of access to healthcare, and the implementation of eliminatory settler colonial strategies by the Israeli occupation that aims to increase morbidity and mortality, such as the de development of Palestinian health and other essential services, exerting full control over and now withholding the water and electricity supply to the Gaza Strip, and the deliberate targeting of limbs leading to traumatic limb loss and disability in the occupied Palestine. So why do you call it the most egregious and the most horrible of attacks on the healthcare facilities in the recent history?
Thank you, Banjot, and thank you for the opportunity to speak to you about an issue that, as we all know, is timely, and also is horrific in its scale and severity of violence. I think we all need to be talking about what's happening in the conflict between Israel and the military wing of Hamas in Gaza at the present time. The reason we described what's happening at the moment as the most egregious in a long history is for precisely that reason, that the scale of violence far surpasses anything that we've seen in recent decades in terms of Israeli violence directed towards the Palestinian people. The latest statistics from the UN Office for the High Commissioner of Humanitarian Affairs tell us, as of yesterday evening, that almost 10,000 people have been killed in Gaza since the 7th of October. The number currently stands at 9,488, with hundreds, if not thousands, of people still trapped under the rubble. But what we really wanted to articulate in this paper is that this violence hasn't appeared out of nowhere. This is the latest iteration in a long history of violence. And it's really important for us as healthcare workers, as peace advocates, and in fact, as humanitarian workers, to understand the context in which violence is committed. Who is committing violence, against whom, under what political, economic, and social circumstances. And that's what we've tried to articulate in part in this paper.
You also gave a political context in your paper. Uh, Usually, healthcare workers or healthcare force doesn't talk about politics, but this conflict is all about politics. So you take a very strong stand and you take the conflict back to more than 70 years ago when it started. So why did you feel to give a political context to a paper which is essentially appearing in a medical journal? Why did you feel the need to do so?
I think this is a common misconception with respect to healthcare workers and medical workers. Health, as we know, is political. We talk increasingly about the political determinants of health. That's very much in keeping with a public health sort of philosophy when we think about understanding the root causes of ill health. We can't do our best for our patients, but we also can't do our best at a population level for communities and populations if we don't understand the underlying causes of ill health and illness. So we have to understand political dynamics. It's that there are folks within the medical profession who would prefer not to talk about politics, but that would really, I would strongly argue that is a mistake. So I think again, we've tried in some small way to speak to as you've mentioned, almost 100-year history. Now, of course, that's difficult in a 1,500 words editorial. We've alluded to some major incidents or moments in the history of Palestine prior to and following the formation of the State of Israel in 1948. But we can't, of course, do justice to that full history. We're trying to really encourage folks to think about these issues and to understand that drawn out chronology.
Right. Uh, you also in one of the paragraphs you refer that the limbs are being particularly targeted. How important is that? The targeting of limbs and particularly limbs, which you refer to in your paper.
We mentioned this because, again, it's a really egregious example of violence committed by the Israeli military against Palestinian civilians. Now, this is a well-documented form of violence. In fact, Israeli soldiers have admitted to this as a military tactic. So there is documentary evidence of this in the public domain. It was mentioned, as I say, because it's a particularly horrific form of violence. And what we see here is almost a double, in terms of sort of military strategy, if I could even afford it such a phrase, it is to, one, inflict harm on the individual, but secondarily to then burden the health system and to burden social services as they are to provide for those individuals who are now left with various forms of physical disability.
Yeah, I was only curious about the fact that is it that if limbs are targeted, it is more effective in terms of military strategy. So why is limbs so particular, in your observation?
So I should say I'm not a military strategist, nor would I want to be. But what I would postulate as a healthcare professional is that, one, you have a situation in which physical violence is being committed against an individual, so they are left with a life-altering injury. But you're also then, as a result, rather than somebody being killed, you are requiring that they then they need to access the healthcare system. They will become, in some instances, dependent on social different forms of social support, either family or other social networks, or the social service system that exists. So in a sense, it becomes a secondary burden on a healthcare system that has already been sort of worn away at by the Israeli blockades.
This is to inflict a long term horror instead of just killing the person in an instant. Is that correct interpretation of mine?
That would be my interpretation as well. Absolutely. So there's immediate violence, immediate physical injury, and then long-term demand on the health and social system.
Okay. There are reports, and again, there are unconfirmed reports because it's not perhaps possible to confirm them. The reports of phosphorus being used, and you have also referred to that in your editorial. Uh, can you recollect in recent history if phosphorus was used in any such attack? And I'm not just talking about an elected government attacking a particular, colony. In any recent conflicts, if phosphorus was used.
So I must say I'm not aware of the use of white phosphorus in other. Just to come back to your question, so I'm not aware of white phosphorus use in other conflict contexts in recent history. However, Human Rights Watch and Amnesty International, both of which are reputable international human rights organizations, they have verified use of white phosphorus by the Israeli military in both Gaza and in southern Lebanon over the course of the last couple of weeks. So use of white phosphorus has been verified. We're also hearing reports from healthcare workers on the ground in Gaza who are describing burn injuries that are in keeping with white phosphorus. Now, as I'm sure many readers and viewers will know, white phosphorus in contact with human skin and also the damage it can cause to the respiratory system can leave one with particularly horrific injuries. The chemical itself continues to burn until it is sort of physically removed from the skin. So it's a particularly horrific form of sort of incendiary weaponry.
So
And
you
should
mean
not,
to say that till the time the chemical remains on the skin, it continues to burn?
so it ignites, and that's exactly right. So you then need to remove it in its entirety from the skin. If it ignites, it will just continue to burn. So it can cause really horrific damage to the skin and to soft tissue.
Okay. Uh, in Gaza, of course, we know that the healthcare systems are particularly overwhelmed. But even if it was not such a situation, and in a situation where healthcare systems are functioning normally, how difficult it is to treat people who have been, who were in touch with this chemical called white phosphorus. How difficult it is to treat these people.
Well, I would say incredibly difficult. I must say I'm fortunate enough to have never had to treat an individual with a white phosphorus injury. I've never worked in a context where it's been used. The WHO, so the World Health Organization, provides a lot of sort of factual information related to the white phosphorus chemical. And as I say, it's this kind of incendiary function. So once white phosphorus has ignited, it can be very, very difficult to extinguish this sort of burning chemical. So it can cause severe burns to the skin, even penetrating as deep as to the bone. Even after you've initially treated, it can reignite. So there can be further sort of burn injuries. It can also cause damage to the eyes and to the respiratory tract. It requires sort of extensive irrigation, often requires debridement, so removal of damaged skin or soft tissue. And in the case of extensive injuries, that can, of course, be a very involved surgical process.
So basically, it requires healthcare workers across specialities to treat one person who got a phosphorus related injury. Is that right?
Absolutely, absolutely.
Okay. You spoke about the fact that after US attacked an Afghanistan-based hospital long back, perhaps in 2021, UN passed a resolution saying that no healthcare facilities would be attacked in any conflict. But now we see that not only hospitals have been attacked, but 2 days or one day ago, even the ambulances were attacked. And you say that in our collective history we would not find an example like this. uh, how do you think that we reached a point that we sort of undid all our past precedents, and now we have hospitals being bombed and ambulances being hit? So as a healthcare professional, uh, what do you make of it?
Mm. I really appreciate this question because we really need to all be reflecting in a very concerted way on what this means about it with respect to our kind of collective humanity. Now, I would say before I speak to Palestine and Israel specifically, that we've seen there's a trend in attacks against healthcare across conflict contexts globally. So we've seen attacks on healthcare in Ukraine, we've seen attacks on healthcare in Sudan. This is not an isolated phenomenon. As you mentioned, so UN Resolution 2286, which was a commitment at the level of the UN Security Council to sort of condemn attacks on healthcare and to call for the needs to protect these facilities in situations of conflict. Now, it was a declaration, it was a commitment, but in many respects, as we know of many UN resolutions, it's very difficult to uphold them. Attacks against healthcare, so facilities, ambulances, healthcare workers, has continued in the years since 2016. And of course, attacks against healthcare facilities were already illegal under the Geneva Conventions. So we have a long history here of acts that we know that have already been declared as a breach of international humanitarian law, and yet such violence, such acts are committed nevertheless.
So,
Um,
do you believe that, we are you saying, despite that resolution, we have had many incidents where healthcare facilities have been attacked in conflicts, but so here is a conflict when an elected government who is a party to the resolution is attacking the healthcare facilities. But there are conflicts where, there are two groups, most probably militia groups, fighting against each other and attacking the healthcare facilities. Do you think that there is such a difference in this conflict, and therefore this difference is important?
I think the scale of aggression is important here. I mean, the one thing that I would say as a healthcare worker is that attacks against healthcare facilities and health workers are a horrific breach of international humanitarian law, and they are not permitted under any circumstance in any conflict context. Um, a discussion about who is the perpetrator, of course, is important when it comes to the pursuit of accountability and justice. So people can't be afforded impunity, whoever the perpetrator may be. But for me, what's most important is that we must reiterate and we must ensure adequate protection for our healthcare worker colleagues wherever they're practicing in the world.
Do you believe that, I mean, there were health attacks on healthcare facilities in the past, and there was not enough reaction against those attacks,
Mm.
and therefore this sort of empowered an elected government to go against to these facilities with complete impunity? Do you believe that the lack of enough reaction in towards the past incidents was responsible, for this crisis, partly at least?
When we see a long history of a lack of accountability, to your question, yes. I mean, if we see, in situations where there is a complete lack of accountability for such attacks, you can imagine then that parties to a conflict will act with impunity because they know that they can get away with the violations of international law. And again, I don't say this in specific reference to Israel and Palestine. This is a global problem. It should be a concern to us all.
I mean, of course, we can say a lot about governments and how they reacted to this conflict. But do you also believe that the reaction that should have come from healthcare community as a whole against these horrific ongoing attacks was also not enough? Why do you think that all doctors and all nurses and all healthcare workers could not come out in one single voice saying that we need to stop these attacks and these are horrific and against
Mm.
humanity?
Mm. So I would say there have been some strong statements. There have been some health justice organizations that have issued statements calling for an end to the violence, calling for um, meaningful investment in pathways towards peace and equality. So there have been some calls, but I would agree that they have not been coordinated or strong or particularly present globally. Um, it's hard to know what might underpin that. Is it that folks, for example, in the UK, don't see this as a shared struggle? I would argue, as a healthcare worker, as someone who has studied, taught, and practiced humanitarianism, that we should recognise what unites us all. And when we see situations such as what we're seeing now in Gaza, in the West Bank, in Israel, we need to be unified in horror, but we also need to be unified in a commitment to doing something about this, to speaking up in pursuit of In the first instance, an end to the violence, and over the longer term, a pursuit of justice and peace. And I do feel that that is a strong responsibility of healthcare workers that derives from our professional commitments to care not only to our patients, but to care for our communities and in the very broadest sense, the global population.
Right. Were you able to speak any of your colleagues working in service in Gaza at this point in time? And do you, if you could capture for us the mental toll that it would have taken on healthcare workers who are giving their services in Gaza at this point in time?
Thank you for this question. I think it is really important that we amplify what we're hearing from healthcare workers inside Gaza, inside Palestine. I get a few messages from folks directly, but I'm also hearing a lot through secondary networks. So colleagues of mine who have Palestinian friends and colleagues who are sharing messages with them, which are then being disseminated. To your question about the sort of psychological toll that that the ongoing violence is having on healthcare workers, it's almost unimaginable, even for those of us who've worked in conflict settings. I think that it's for those of us who've worked in other conflict contexts. Even for us, it's almost unimaginable to conceive of what our colleagues in Gaza must be going through right now. We see a progressive increase in the intensity of violence, in the intensity of bombardments. We have colleagues who've now been working almost non-stop since the 7th of October, providing surgical care, providing emergency care, ensuring to the best extent that is possible their ability to maintain continuity of existing services. So, of course, it's also important, in addition to providing trauma care and so on, we have tens of thousands of expectant mothers in Gaza. We have individuals who were receiving radiotherapy and chemotherapy for cancers. We had ongoing specialist service provision for children. All of these services have been disrupted to a phenomenal extent. So we have colleagues who are trying to the best of their ability to maintain some degree of service provision while also responding to the acute conflict-related needs. And the psychological impact not only of working almost non-stop, minimal sleep, not eating well, not sleeping well, if at all, seeing and experiencing horrific, the horrific consequences of violence, that will leave a major psychological toll on our colleagues working in Gaza right now.
Okay. As you gave necessary or political context in your paper, so if I might ask you, uh, what do you expect from the governments now on? They have done what they could have done or not done what they could have done. But what do you expect from them now on, so far as this conflict is concerned?
What we need most immediately, Banja, is an end to the violence. So the call right now is for an immediate ceasefire. Let us make sure that this situation doesn't get worse than it already is. Beyond that, we have to see a situation in which there is serious, meaningful investment in a peace process.
Okay, this brings to me to the last question. There has been a criticism, if I may say, of your editorial as well. And I believe some letters were also written to the editor in chief of the journal. So, if you would want to respond to that.
Sure. No, thank you for this question. I should begin by saying, while there has been criticism, we've received several compliments as well. There have been open letters submitted to the journal in support not only of us writing this piece, but also of the BMJ Global Health for publishing it. As I'm sure many of your readers will have seen, the conflict, the ongoing conflict, and the broader situation in Palestine and Israel is an incredibly polarizing topic. Some individuals took issue with the way that we had framed this issue. They felt that we were speaking too strongly to violence committed against Palestinians. What we were trying to do in this piece, of course, is the BMJ Global Health editorial. It doesn't exist in a knowledge vacuum. We know that many major mainstream media outlets are reporting on the violence in Palestine and Israel right now. Many have spoken to the horrific atrocities that were committed on the 7th of October against Israeli civilians. While we do acknowledge that in the introduction to this editorial, some folks felt that we didn't speak to that in the way that we should have done. And I say in response to that, as I've said, that this editorial exists within that wider knowledge base. We recognize that many outlets are speaking to these very important issues, particularly events that took place on the 7th, and of course, the several hundred Israeli hostages who are still kept in who are being held captive inside Gaza. Other folks, as you've alluded to in some of your earlier questioning, aren't happy with this sort of blurring between the medical and healthcare professions and political positioning. And as I've said already, I think that we need to recognize that medicine is political, healthcare is political, and we shouldn't shy away from navigating the complex and messy world of politics.
Fine, Professor James. Thank you so much for taking out time.
Thank you. Thanks for inviting me.